Right, 10 minutes before the top of the hour, the South African Drug Policy Week kicked off on Monday in Cape Town and is part of the 5-year National Drug Master Plan, which expires this year. Researchers from around the world will be attending Policy Week. Here, the National Drug Master Plan will be discussed, as well as policies and amendments. International researchers will also share their expertise as to policy making. Well, joining us this morning is Shaun Shelly. He's the organiser of the SA Drug Policy Week. Shaun, thanks so much. Good to have you here on Morning Live.
It's my absolute pleasure, and thanks for having me.
All right, so we talk about this National Drug Master Plan. It ran from 2013 to 2017. What would you say have been some of the achievements from it?
Well, you know, as a member of civil society looking at the National Drug Master Plan, I think there were some important movements in the previous Drug Master Plan, which was looking at the aspect of harm reduction. Unfortunately, I think from a lot of people's point of view, it wasn't defined correctly and didn't comply with international definitions of the term. But I think it was a step forward. I also think that in the last National Drug Master Plan, the recognition was there that communities needed to be consulted, which was something that has perhaps been missing before. Of course, the one thing that was missing was the consultation with the community that was most affected by it, which is people who use drugs themselves. There was no process for that, and that's happened this time. So my hat off to the Central Drug Authority. They've actually consulted with people who use drugs, who are an important constituent, and there's actually a report coming out on that in the next couple of days.
Interesting. This is obviously day 3 of the SA Drug Policy Week. What's come out of it from international research thus far?
We had a very interesting talk yesterday by Professor David Nutt on a multi-criteria analysis of the harms of drugs. But he also released the first data on the harms and benefits of certain drug policies. And what was really interesting of that is that regulation, sort of some level of regulation of drugs, is the best way and the least harmful way to manage drug use within communities. There's an inevitability that people are going to use drugs in one way or another. And so there needs to be some sort of regulation, because if you don't know what dose you're taking, if you don't know what the purity is, you know, you're going to do a lot of harm. And especially with the policing of drugs at the moment, we see a lot of people who are being criminalized while other people aren't being criminalized for exactly the same behavior. And obviously once somebody's criminalized, you limit their choices in life, and drug use, you know, paradoxically becomes a better choice for them often.
Yeah. I mean, South Africa is in the crux of what could one call a drug crisis, because it is a very, very bad situation here in the country when it comes to drug abuse. What do you think is going to be tabled after all of this? I mean, it's great to talk about it, but what will happen thereafter?
Well, I think that we've seen growing acceptance of harm reduction programs, which don't seek to necessarily stop people using drugs. They seek to give them access to health services, which is essential. And we find that by concentrating on their health needs, people actually reduce the levels of drug use. Whether this goes into legislation or not, I'm not sure. I think we're way off from things like decriminalization or legal regulation. But I think that we can start moving towards frameworks which will allow for more open debate about drugs and more options to be experimented with. So while the future is a little bit murky, I think that the new document will allow for changes to happen over the 5-year period when it's going to be implemented up to 2022.
I mean, obviously, drug abuse and drug use is a global problem. I don't think there is anywhere that's immune to this. But if we have to compare ourselves to the rest of the world, how bad is the situation in South Africa?
Well, it's interesting because there's been some reports saying that we're one of the top worst countries in the world and that kind of thing. That's simply not true. The truth of the matter is we simply don't know. We have no epidemiological data on population size studies. The last study was done in 2012 or 2011, in fact, reported in 2011, I think. And that was sort of a representative sample, but it wasn't a specific study looking at drug use, and it didn't differentiate between the different kinds of drugs. And there are lots of different kinds of drugs. You know, somebody who smokes perhaps cannabis on a daily basis is very different from a person who's injecting heroin on a daily basis. But in particular, in a prohibitionist environment where the heroin injector isn't getting access to clean needles and that's particularly harmful. We're seeing very high rates of hepatitis C. We're going to see increasing rates of HIV amongst injecting drug users. And these are things that we have to bear in mind. If we want to protect people and the wider community, we need to bring about interventions which are attractive to these people and prevent the spread of infectious diseases.
Okay, let's bring it to present day right now. We're seeing the so-called Dagga couple in court at the moment, and I mean, if we go back, they were apprehended in 2010 for using Dagga in their house. They appeared in court this week. We haven't heard anything because of the whole wanting to live stream the event issue, but I'm sure it'll get underway very, very soon. Just in light of what you've been hearing and in this conference, we talk about Dagga. Many people talk about it as a light drug, and it has wonderful medicinal purposes, but to go and legalize it for recreational use, in your honest and professional opinion, do you think it is the right thing to do? Does it lead to harder and more drug use, or can it be contained?
Yeah, everywhere in the world where they have decriminalized the use of Dagga or introduced legal regulation, we've seen a drop in other problematic drug use, the use of opioids and heroin, particularly in the United States. The fact of the matter is there have been centuries of non-problematic cannabis use in South Africa. Now, that doesn't mean it's safe for everybody. The narrative that, oh, it's natural, it's a plant, is not valid, in my opinion. Heroin comes from a poppy, which is natural in a plant as well. For some people, cannabis can be dangerous. If you've got a predisposition towards psychotic disorders, certainly it's not a good idea to smoke copious amounts of high THC cannabis. But nuts can kill some people as well. We don't ban nuts. By actually prohibiting cannabis, what's happening is stronger and stronger strains are coming out, and more importantly, we're getting synthetic cannabinoids, which are particularly dangerous. I think it should never have been criminalized in the first place. It was criminalized purely for political and racial motivation.
All right, let's leave it there for this morning. Thank you very, very much for talking to us here on the program. So it's the SA Drug Policy Week that's taking place to develop a national drug master plan, and we'll certainly follow up on that and find out what the findings are and how it's going to curb the drug use situation here in South Africa. In our Cape Town studio was Shaun Shelly, organiser of the SA Drug Policy Week. Let's take a break. News after this.